Good evening everyone. Welcome to this informative live session where we will delve into a crucial topic, valvular heart disease. I'm your host, Maitri, and I'm delighted to introduce our expert for today, Dr. Gautam Naik, a distinguished cardiologist. Welcome, Dr. Naik.
Thank you, Maitri. It is indeed a pleasure to be here today to discuss on valvular heart disease, which is an important topic. This is especially pertinent as this week is Heart Valve Awareness Week. So let's get started.
To kick things off, Dr. Naik, could you help our viewers understand what is valvular heart disease?
Valvular heart disease is disease of one of the four heart valves. The heart, as you know, has four heart valves and four heart chambers. Two out of those are right-sided heart valves. They are called the tricuspid and pulmonary valves, and two are left-sided heart valves, namely the aortic and the mitral valve. Diseases in these can either be stenotic or regurgitant. Stenosis means one of the four heart valves has narrowed, which prevents or obstructs blood flow into the chambers. Regurgitation means leakage or incompetence of the valves wherein blood flow is opposite to the direction of intended flow. There are many causes for them. Mostly the valvular heart disease is degenerative. In India, rheumatic heart disease is an important cause of heart disease, and in 40s and 50s we see patients with mixed etiology.
Thank you, Dr. Naik, for that insightful explanation. Now, let's discuss what are the symptoms in patients having valvular heart disease.
Valvular heart disease can present in a number of ways. It depends on the valve affected and whether the condition is stenotic or regurgitant. But by far, the most common symptom of valvular heart disease is breathlessness or shortness of breath. Patient typically finds this after exertion, and in advanced stages it can lead to shortness of breath at rest. Another common symptom is fatigue, and many a times patient complains of just feeling tired or not wanting to having enough energy to do work. These are reflective of reduced cardiac output states. Many a times shortness of breath can progress to patients having heart failure and failure symptoms, wherein there might be repeated heart failure hospitalizations. Another important symptom is angina. It is a misnomer that angina or chest pain can also be caused by coronary artery disease. It can also be caused by valvular heart disease. Many of the times patients can complain of syncopal attacks or feeling dizzy, especially when the etiology is stenotic or narrowed heart valves. And sometimes, especially in advanced aortic valve disease, both stenotic and regurgitant, there can be no symptoms for long periods of time, which is why a timely clinical assessment in your 40s and 50s is very important to get ahead of the curve and diagnose this condition early. Sometimes palpitations can also be a symptom, especially in regurgitant valvular lesions.
Thank you, Dr. Naik, for shedding light on the symptoms in patients with valvular heart disease. Dr. Naik, how is valvular heart disease diagnosed?
There are multiple ways in which you can diagnose valvular disease. First of all, the most important thing is to have a high index of clinical suspicion for the condition, because valvular heart disease patients have symptoms which are, as listed above, varied. So paying regular visits to your doctor or cardiologist is one way of keeping in touch. With regards to diagnosis itself, a thorough physical examination in the clinic is what is essential, and echocardiography remains the mainstay of diagnosis in this condition. It remains at the center of all the investigations. Both transthoracic and transesophageal echocardiography are important measures to screen for valvular heart disease and also look at the response to treatment. Next we come to CT scans. CT scans are essential for planning procedures, especially in the therapeutic range. For example, a patient who requires a transcatheter aortic valve replacement, a CT scan can guide us in accurately measuring the size of the valve and the feasibility of the procedure. With regards to other investigations, MRIs are very important investigations in patients with valvular heart disease.
Thank you, Dr. Naik, for explaining how valvular heart disease is diagnosed. What are the treatment options for patients with valvular heart disease?
The treatment options are limited with regards to medications. While medications may be helpful in patients with valvular heart disease, especially in regurgitant lesions, they are of very little use in patients having valvular stenosis. Surgery until very recently used to be the mainstay of treatment, but in the last 10 to 15 years, various transcatheter procedures are in vogue to treat all 4 heart valves, and the most commonly performed are left-sided heart valve diseases, namely transcatheter aortic valve implantation or transcatheter aortic valve replacement, or TAVI or TAVR for short, which has been a game changer in treatment of patients with aortic valve disease. This valve is similarly replaced in the mitral and pulmonary positions as well, and there are dedicated transcatheter therapies in the pipeline which can treat this. Of course, surgery remains an important modality of treatment in both left and right-sided valvular heart disease.
Thank you, Dr. Naik, for that insightful explanation. Dr. Naik, can this be prevented?
With regards to prevention, it is very less likely that valvular heart disease itself can be prevented. So the old adage goes, prevention is better than cure. Not particularly in this condition. An early diagnosis in the cases of valvular heart disease is very important. However, in our country, as many of the valvular etiologies are rheumatic in origin, early diagnosis and treatment of rheumatic fever in childhood may go a long way in preventing rheumatic heart disease. But by and large, the valves other than rheumatic heart disease, it's very difficult to prevent. Thank you.
Thank you, Dr. Gautam Naik, for sharing your expertise on valvular heart disease with us today. This discussion has been incredibly informative, and I hope our viewers have a better understanding of this condition. Any message for viewers?
Yes, so thank you viewers, and thank you Maitri. This Heart Valve Awareness Week is very important. The public awareness message that needs to go out is that heart valve disease is important. Heart valve disease can kill, but early diagnosis and treatment of heart valve disease can be a lifesaver. Thank you very much.
Thank you to our viewers for joining us today. Your health is paramount, and knowledge is a powerful tool in protecting it. We'll be back with more informative sessions in the future. Until then, stay informed and stay healthy. Goodbye.